Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today, we'll be discussing infection control in long-term care with a live Q&A. If you have a question about infection control or immunizations, you can submit it to us using the chat or the Q&A tool. And if you would like to ask your question out loud, you can also use the raise your hand feature to request to be unmuted. We invite you to join us every Wednesday at 2 p.m. for more of the webinars in this series. Next week, we will be discussing non-pharmacological pain management. And now I'd like to introduce our guest today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, welcome. Thank you for joining us again.
Thanks, Kathy.
So we have a pre-submitted question here. For those of you who don't come to our Q&As very often, we usually set up a form in advance where people can submit their question ahead of time. So for future Q&As, you can keep an eye out for that. This question says, with all the current changes regarding COVID, are we still required to have designated green, yellow, and red zones? And if so, do we still need to have marked by signage?
Thanks, Kathy. So at this time, the designated green, yellow, and red zones are not required. However, to ensure the safety of residents with suspected or confirmed COVID-19 infection, it is recommended to place them in a private room with a designated bathroom. However, in some facilities, space is an issue. So if multiple residents need to be housed together, it is important to ensure that they have the same respiratory pathogen. So both COVID-19 positive, or if you're cohorting for flu, both flu positive. And you'll also need to consider other communicable diseases. So if one has MRSA, they can't be cohorted with another person who does not. And high numbers of COVID-19 residents, entire units used to be, designated with the red, yellow, and green sections. However, that's no longer required, but if possible, try to have designated healthcare professionals be with the residents who are COVID positive. I have also gotten questions about transmission-based precautions for close contacts. So this would, I guess, be under the old yellow scenario. So if a resident has been in close contact with someone who does have a positive COVID-19 infection, they're generally not necessary to take precautions if they're asymptomatic. However, residents should still wear a mask or other source control. If they are not recovered from the COVID infection in the past month, they should get tested according to the recommended testing schedules. There are certain situations where it is advisable to, use transmission-based precautions as a precautionary measures. For instance, if a resident is unable to get tested or wear a mask as recommended, also if they are severely immunocompromised, or if they're staying in a unit where others are severely immunocompromised, also where there's ongoing COVID-19 transmission and it's not being controlled by other interventions. So, if the resident is placed in transmission-based precautions due to close contact with someone with COVID-19, they should remain in precautions. And if they don't develop symptoms and all the viral testing comes back negative, they can be removed from precautions after the exposure.
All right, thanks, Jen. And we haven't received any questions so far. So I think you said you had a resource you wanted to share, or if there was anything else you wanted to talk about before we circle back to the Q&A.
Yes, so one of the resources that has been newly released is the vaccine tracking worksheet. So I mentioned this a couple weeks ago during one of our webinars, and we sent the worksheet out to a few nursing homes to trial it and give us feedback on, how the formulas are working. So we have the updated version available for download. This was included in our last minute download last week, and it's also available on our website. So I just want to go over that, do a quick demo of the vaccine tracking worksheet, and answer any questions that anyone may have about that. So this worksheet was developed and formulated to track pneumococcal vaccinations and flu vaccinations for residents over the age of 65. It's based on the most updated recommendations by the CDC. And I'm just going to share my screen here so that everyone can see. Okay. So this is the landing page for the pneumococcal vaccination worksheet and vaccination worksheet. So this just has the instructions on how to use it. The most current recommendations are here, and a link to the Pneumorex Vax Advisor, which can be used as a resource if anyone is unsure about, how they need to proceed with a particular situation. And also the updated recommendations about flu, which, everyone over 6 months is recommended to get the influenza vaccine every year with very rare exceptions. So this is the pneumococcal tab. For this tracking worksheet, it's necessary to add a name and date of birth. These are the two required fields on the worksheet. There's also space to put a floor and room number so that you can track within your facility. And these areas here are to put the dates of vaccines that your residents have received. So let's just start with John Joe, and he received a PCV 20 on 8/23. So when that date is entered in, we have it showed that it turned green and he's up to date for the PCV 20. These fields here are not lit up at all because he's up to date with just that. But however, they can have a decline for the PCV 13 or PCV 15 and have them grayed out if they did not receive it. It's really up to you. We changed this around a little bit, so it's not really necessary, but you can gray that out if you would like to. Okay, and we'll try another scenario here. So let's say that the resident got a PCV 15 on 20. Okay, and because this is over a year old, it'll show that they are not up to date with the PCV 15 anymore. And you can satisfy that with either, getting a PCV 15 or the PPSV 23. So let's just do the PPSV 23. And we'll say they got it yesterday. And now that scenario is up to date. So we have another resident, so let's just say that they got the PCV 13. Okay, long time ago. So because, this is not up to date, they'll need to follow up with additional vaccines. So we can give them another PPSV 23. And we'll say that they got that this year as well, and now they are up to date. So this is just a way to provide some visual cues and show when people, have had vaccines and are due for another, and, show when they are up to date. So you can see at a glance, who's good and who's not. So let's see. Let me try to get a. I'm going to try to do a scenario with a yellow. And that didn't do it at all, but that satisfies as well. So there are situations where, it's been over 5 years and an additional dose may be indicated. And in those cases, the section will turn yellow. Just to give you a cue that you need to speak with the provider about, possible second dose. And if a dose is not indicated, there is a selection for the decline stating consulted with provider. No additional doses are recommended at this time. And that would satisfy the vaccine administration and turn the box green.
Hey, Jim, we're getting a couple of questions about this spreadsheet.
Okay.
And I think they actually might be similar questions. The first one says, what if they have two PPSV 23?
Mm-hmm.
The other says, is there a way to put in more than one date for a vaccine? Example, a resident has received two PPSV 23.
There is not currently two columns for the PPSV 23. However, there is a notes section here where you can put in special considerations like that.
Okay, thank you.
Questions about the pneumococcal spreadsheet?
We have another question about infection control, but if anybody else has any other questions about this spreadsheet, it'd be good to go ahead and answer those first.
Yeah.
Oh, we got a couple more. Let's see. Will we be able to add a COVID-19 vaccine tab?
At this time, we don't have a COVID-19 tab, but that is a consideration we'll take into account.
Mm-hmm.
Okay. I just wanted to move on quickly on the influenza vaccine tracker. This sheet is a little more straightforward. Like I said, there is information here about the influenza vaccines. So for this one, it says to enter the flu season begin date. So right now it's defaulted to, this current flu season start date of 7/1/22. But going forward, if you have, you're going to be tracking for next year, you can change that to 7/1/23, or, however you like to do it. And basically anyone who has not had a influenza vaccine within the current year, they would be able to put that date in here. So let me just put an old one in. So we'll say 5/2/21 was their last vaccine, and we'll see that that remains red. However, if they got it back in 22, they're green. So at a glance, you can see, who is current and who is not. So you can put in, any date here. And then it has information here about the administration location, if they got it within the facility or outside of the facility. There is some reporting that needs to be done where you need that information. If they've declined, yes or no. Reason for decline, and it has medical contraindication, concerned about side effects, perceived low risk, arrived outside of flu season, if they have an allergy, and you can put a note in there about what that allergy is, against their religious beliefs, or not eligible. Again, if there's any additional information that is needed, you can put it there in the notes. But we'll just say medical contraindication to that person. Okay.
We got a couple more questions. This one says, should we be using the influenza tracker now, even before the start of the flu vax season?
At this time, the influenza, since we're sort of in that, gray area here, this influenza tracker would be best to either track last year's flu information for reporting on the, past flu season, or you can start fresh with the new flu season.
Someone else asked, can a red not up to date be overridden if it's not accurately turning to green?
It can. You can use one of the declined to gray it out and write information on the pneumococcal with additional notes explaining, why.
Yeah, can I just add something to that one, Jennifer?
Sure.
So, Amy, I know that you were one of the facilities that were testing this for us. So first, we want to make sure that you have the most up-to-date version of the tracker, because we originally did find some issues with some of the formulas, but also some of them may not be turning green because of the situation that Jennifer said about if it's been 5 years since their last vaccine, and that's where you would pick the reason for declining. You would say that it was reviewed with the provider and no new vaccines at this time, and then it should change that to green. But if you have specific situations where it's not turning and you feel it should be, please reach out to one of us, because we want to make this as user-friendly as possible, and we want to make sure that the dates you're putting in, it is turning the colors the way they should turn the colors. If it's not, it kind of defeats the purpose of what Jen has worked so hard on creating here.
Okay, thank you, Deb. Deborah Wright is one of our quality improvement specialists. And yes, this new tracker that we're using, you can see at the very top, it says Vaccine Tracking Worksheet 2.0. For those of you who were helping us test, it was originally called Vaccine Tracking Worksheet Final. We realized that there's probably never going to be a final version of this. We're going to keep updating and making improvements, maybe adding a COVID section eventually. So that's where we're going to start calling it 2.0. Future versions might be 3.0 and so on. This next question says, are LPNs able to read TSTs in Pennsylvania? I'm not sure if that relates to the worksheet or not.
No.
I'm sorry.
So let me just check. I'll double check it. Every facility that I've been with has had it in their policy that it was RNs. However, it may be allowed by regulation. Deb or Penny, do you know if the regs show that an LPN can do it?
I don't have it right up in front of me, but I was always taught that it was outside of the scope of practice for an LPN to read a PPD.
Okay.
They could
Place
give a, there was always a discussion about whether they could administer it, and it did change that they could administer it as long as there was a competency on file at your facility and it was in your protocol that the LPNs could administer the TB with an acceptable competency. But I don't believe they can read, but that's something we can all research a little bit further and get back to you.
Okay, thank you. And then I have one question about infection control that was submitted earlier. If anybody else has any questions about this vaccine tracking worksheet, please go ahead and submit it at this time. And I also wanted to note that I put the link in the chat for where you can download it. But this resource library that we use, sometimes it doesn't play nice with people's email inboxes. So if you enter your information and it doesn't come through, please contact me. Sorry, I muted myself when I was trying to share my video. Please contact me at ccaudell@qualityinsights.org. If for some reason it doesn't come through, I can send it to you directly. And then this final question that we have about infection control so far, it says, if a facility is asking about a good policy procedure manual for infection control, what would you recommend?
So there are a lot of sample infection control policies. If you have access to APIC files, there are a lot in there in the resources. However, if you don't have access to a database like that, you can reach out to me. I can send you some sample infection control policies.
Okay, thank you. And that's all the questions we've received so far. I'm getting ready to put my email in the chat. Oh, we had another one come through. Does anyone have any feedback on COVID admission testing due to the end of the PHE?
So the COVID admission testing is not currently a part of the requirements with the ending of the PHE, but it is, recommended to, update your policies, your, facility policy to reflect your, process for admissions. But in general, just general screening for asymptomatic people are not recommended.
Okay, thank you. And Jennifer, was there anything else you wanted to talk about or touch on as we wait for any last minute questions coming in?
No, I don't have anything right now. But if anyone has any additional questions, I'd be happy to discuss them here.
Okay. And thanks for all the questions that we've gotten so far. In that case, I'm going to run over some quick closing items. If you have any questions, again, you can submit them using the Q&A or the chat, or you can also raise your hand if you would like to ask your question out loud. Again, I'd like to invite everyone to next week's webinar, which will be on non-pharmacological pain management. That webinar will be next Wednesday at 2 p.m. And we also invite you to bring your questions to our virtual live chats, which are every Tuesday and Thursday at noon. Deborah Wright will be there to answer questions on topics like quality improvement initiatives, infection control, or MDS coding. You can find the links to the live chats and our webinars in the newsletter that we send out each Friday called the Last Minute Lowdown. And if you would like to receive that newsletter, but don't think you're on the mailing list, you can contact me at ccaudell@qualityinsights.org and I can add you to our mailing list. And my email is in the chat. I can add that again along with that link if anyone didn't get to see that link earlier. And let's see, we got a couple more questions coming in. Is there any clear guidance on staff members and guests temping in daily?
So I think they're referring to the pre-screening at the front desk when they arrive to the facility. And for that, that is no longer required. It is required to have signage related to any symptoms that the person might have, and reminding them if they are having symptoms, if they have tested positive for COVID-19, that they should, delay their visit until, either their quarantine period is completed or, they've been tested negative, for COVID-19. So that signage is really the only requirement. Some facilities have chosen to continue screening as an extra precautionary measure, and that's okay as long as it's a part of your policy to do so.
Thank you. We have one more question in here again. It says, please clarify, is daily COVID screening required?
Is thinking for residents, Kim, is that what we're asking about here?
Yes, for residents.
Okay, yeah, so daily screening for COVID-19 is not required for residents. I know that was a requirement in the past, but that is no longer included in the guidance.
I'll just add, I've seen some uptick in surveyors going into facilities where they might have residents who have respiratory symptoms, and just with the ending of the PHE, that the facilities are getting a little lax with testing. So the guidance for the ending of PHE is specified that you still have to continue to test if residents are symptomatic, and that you're going to face citation if you do not. So I think that's really important to keep in mind. If you have a resident with respiratory symptoms, you need to be screening them still. And that has to include COVID testing.
Yes, thanks, Jean. That is a really big thing. And also, just making sure that we are keeping track of any symptoms that residents might have, and making sure that we're taking the proper precautions. And, if another thing that's sort of related to this, if you have a situation where a resident tests positive, they cannot remain in the room with their roommate who hasn't tested positive and maybe not even showing symptoms, just because they've been exposed. They have to, the COVID positive person has to be in the COVID care area.
All right, thank you. And I think that's it for all of our questions today. If you have any questions that we didn't get to, or you didn't get to type in, you can contact Jennifer Brown at jbrown@qualityinsights.org. And I think I'm going to wrap us up. Before we sign off, I'd like to ask everyone here to please answer a short evaluation of today's webinar. The evaluation is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Jennifer, I'd like to thank you for joining us again today. And I would like to thank all of you for joining us again today. Hope you have a good week.
Thank you.